Good afternoon, everyone, and thank you for joining us to celebrate In-Demand's Jobs Week this week. My name is Amber Jenkins, and I am the Workforce Development Administrator for Erie-County, Ohio Means Jobs. I am joined today by Tina Krieger, and she is the Deputy Director of Community Service, and she will be helping us out with our slides today and the QA portion of this event. A little bit about this week. In-Demand's Jobs Week is a statewide celebration of jobs, industries, and skills that are in demand in Ohio. This is a great opportunity to learn more through local events and activities about the rewarding and high demand careers available. A lot of different people are doing a lot of different projects this week. We have actually partnered with a lot of employers, and they will each be presenting, they'll be talking a little bit about their industry, the available positions that they have, job qualifications, how one would go about applying for a job with them, and anything that an applicant would need to know. Today, we are focusing on senior care industry, and we have Brittany Bowers here from Providence Care Center, Julie Wenzinger from Cambridge Home Health, Mary Engelhart from the Meadows, Kayla Alton from Admirals Point, and Laura Lee Krabell from Sandusky Career Center. If you look at the top of your screen, there should be a Q&A portion. If you want to type in any questions in there, we can answer those for you. Or if you have a specific question for an employer, you can type it in there and we will send it over to them and have them answer your questions. If you do want to put your personal information, such as your name and email in there for us to send you any of the flyers for today's events, or if you have something that you want to send over to an employer, you can put that in there and we will make sure that that stays confidential. This will be recorded today, and we will have this recording then posted on our website and also be handing it out to people who were unable to attend the live event today. We do have a few more events scheduled this week. You can check those out at our website, omjec.org, and you click on the Job Seeker tab. Once we are done with the presentation today, all the videos will also be posted in that same spot. Be sure to check out everything that we have to offer here at Ohio Means Jobs, Erie County. Our lobby is still closed, but we are taking appointments. So if you did want to come in to job search, or you need help with a resume, or you want to connect with one of these employers that are going to be talking today, you can call us and set up an appointment and you can come in and we can help you out with those things. Please make sure to like and follow us on Facebook and Instagram. We post all of our open positions, all of our events. Everything is always posted on those, so it's always good to check those out. And we will go ahead and we will get started with our presenters today. And up first, we have Brittany Bowers, and she is from Providence Care.
Hi, everyone. My name, as she said, is Brittany Bowers, and I'm the Human Resources Director at Providence Care Center and also the Commons of Providence. So we have a lot of different jobs at Providence, and I mean, nursing is the biggest one. We start from our RNs and LPNs, which you have to be certified and licensed for those. And then we do offer STNAs for the Providence Care Center. And then for our memory care and assisted living units, you don't have to be certified. So even if you don't have a certification or an STNA, if you have home health experience, you can always apply on Indeed with us as well. Our company has changed a lot over the past couple years. We were the Franciscan Living Communities, which was ran by all of the sisters through Franciscan Living up in Slovenia. And now we are ran and operated under CHI Living Communities. So there's been some corporate structure change, and I think that it has been for the better. We are really able to do a lot more with the corporate purchasing power that we have for our employees. And I think that's why it makes it such a good place to work at. All the benefits that come with working for us is amazing now. Even in the few years that I've been working there, it's changed dramatically. The positions that we're currently hiring for are our PCAs, which is our STNAs that aren't certified over at assisted living. We are also always in need for STNAs and LPNs and RNs at Providence Care Center. And from time to time again, we'll have dietary, housekeeping, laundry, activities. All of those positions come with that as well. And we had a few receptionist positions that we were thinking about opening up, so that's always something to watch out for as well. The person that we would like to hire in this type of industry is going to be very hands-on. They love working with people and for people. You have to be dedicated. There is a lot of burnout that we're noticing in the healthcare field, especially after COVID. And our company offers 4 weeks of PTO right off the bat that you could start using after 90 days of employment. And I feel like it's a nice transition. Going into a field where it's nonstop, you do need that time for yourself. So that's one of the benefits that our company does offer for people. Another quality of somebody that we want working for us, they have to be dedicated. You have to come to work on time. This is for all healthcare fields, and it's across the board. We have a lot of turnover, and I think it's due to the stress of COVID. So the way that we see it is you're there doing a service for the residents and for the families, and how would you want your grandparents to be treated? We really need dedicated people that are always going to be committed to us. As I stated earlier, the special degrees and certificates required, they do vary depending on the position that you're applying for, but they range. And even if you have no experience, you can always get a job with us. And then the benefits. So our company offers full-time employees all of the medical, dental, vision, 401k matching. We do the PTO. We have recognition, employee assistance programs, and those vary too depending on what the situation is. We do tuition reimbursement. We've actually paid for people to go to school to become SPNAs, and it's just for free. So we do offer a lot for the people who are dedicated to us. The ways that you can apply are very simple. So you can get on your phone and go on Indeed and look for CHI Living Communities or Providence Care Center. I will let you know that if you search it, Indeed sometimes brings up this other Providence Care Center in Beaver Creek, which is not our location. We are in Sandusky, so just make sure that you are applying to the right one. And our website as well, CHI is under homeishere.org. So you can search. We have 12 locations across the country. Make sure that you're selecting the ones in Sandusky, and that's basically it. You can always walk in and get an application too.
Awesome. Thank you so much, Brittany. And if anyone has any questions for Brittany, please do go ahead and put them in the Q&A, and we will get those over to her. Up next, we have Julie from Cambridge.
Hi, everyone. Hope everybody's having a good week. Thank you. I appreciate the invite and having the opportunity to talk about who we are and what we do in the community. Cambridge Home Healthcare has been in the Sandusky area for a very long time, and it has been owned by several larger companies. Our company is actually owned by LHC Group, which is the third largest home health provider in the United States. So we serve people everywhere. LHC Group not only has home health, but they have hospice, they have LTACs. So we are nationwide. In the state of Ohio, we have 20 offices. So, and they're all under different names. LHC Group has taken us all in under the umbrella. You might find us as Wellsbrook, you might find us as Blackstone, you might find us as Almost Family, and you'll definitely find us as Cambridge Home Health Care. This particular agency, we service the counties of Ottawa, Sandusky, Huron, and Erie County. We abut into our Toledo office on the outer portions of Ottawa County and our Sheffield Village office over in the far edge of Erie County. So our agency, we service clients in those communities. Most of our clients are the older adult population. However, we have contracts with several boards of developmental disabilities, and we also see clients in their home for that. We also have contracts with the Veterans Administration, so we also take care of veterans in their homes. We have registered nurses, licensed practical nurses, and we have CNAs. We also have STNAs. So to be able to work for us, obviously, if you are a nurse, you need to have current unencumbered licensure as an RN or as an LPN. If you want to work for us as a home health aide, you can come to us as an STNA, you can come to us as a certified nursing assistant, and most recently, our company has developed during COVID a virtual home health aide course that has been approved by the Ohio Department of Aging. And this course was a 75-hour course where you could learn what it needs to be a CNA, and then the last 15 hours is spent doing competency testing in office with our staff, and then we complete your orientation. Once you've met all of those requirements, complete your orientation, do additional competency testing in the home with the client, and you're good to go. The things that most people like when they come to work in home health care is that you're kind of on a more level a more level playing field with your clients. You're going into their home. And so that a lot of times gives them a better sense of reassurance. You know, they're in their home territory and you're coming in to see them. One of the other benefits is that you are seeing somebody one-on-one. When you are in the home with the client, you know, maybe there's another family member there, or, you know, maybe the neighbor has stopped by, but you are only there to provide for that client. And there's a lot of beauty in that. You develop really strong relationships. They feel supported by you. And it's just, if you've never been working in home care, you might not ever understand it. But the people that work in home care, this is why they're there. They really like that one-on-one. And for a lot of us older nurses, we understand what that was like in our nursing training. I mean, that's what we were kind of groomed for, that type of compassion. Unfortunately, nowadays, you don't see that as much. What we are currently hiring are for all of those. We are always in need of registered nurses, LPNs, and we are very much in need of home health aides. Since COVID hit, we had probably a challenge to find qualified folks even before COVID hit. And then once COVID hit, it's just really augmented that challenge by 100%. Like I said, you don't need to be a certified nursing assistant or an STNA to come and work for us. If you have the capability to take the virtual class, then we can work with you in that. Otherwise, we do like to see, as an STNA or a CNA, that you've had at least a year of experience being supervised by an RN. And you could come to us from any of the industries, home health care, obviously, long-term and skilled care also. The type of candidates that we are looking for is that we need somebody that can work independently. We need you to be self-motivated. We need you not to require a great deal of supervision. We need you to have an incredible amount of integrity. Because you're out there and you are unsupervised, you need to be able to be your own person, to work autonomously, and to do the right thing because it's the right thing to do. So you need to have a strong work ethic. If your client is expecting you to be there on a certain day at a certain time, we expect you to be there. Our clients really depend on us to provide that care, and when we don't show up, then who's there to take care of it? Benefits that our company offers right now we have a sign-on bonus for our HHA positions. If they are interested in applying, you can go to LHC Group, LHC as in Louisiana Home Care. So it's lhcgroup.com. Once you go to that main website, you're going to search for the state. Click on the state, and then you will search for the office that you want to apply for. Obviously, we would like it if you would apply for the Sandusky agency. Once we receive your application, we will reach out to you and schedule a time for you to come in and talk to us. At that time, we'll answer any questions you have about the sign-on bonus. The hours are incredibly flexible. You work with the client to establish your schedule. Of course, we have our parameters from our payer sources, whether they are passport, waiver, Medicare, Medicaid, or the VA. They will only authorize us so much time to be there. But we work with them and we work with the employee to get those hours scheduled. We have weekly pay here, which is something that people really like. I like it. It's just really nice to have a paycheck coming in every week. We have a 401k that is offered for individuals that work 32 hours and over. You also can accumulate paid time off at 32 hours and over. And if consistently month over month you are working 32 hours and over, you will also qualify for the medical benefits program. We can schedule you as close to home as you want to be, again, because we serve so many different communities. You know, if you live in another area, we can make sure that we schedule you closer to home. It's a great culture here. We have things that go on every month that we do to support our employees. Tomorrow begins National Nurses Week. Tomorrow we are having Olive Garden lunch for the employees to come in and spin through and take a takeout box with them because they're busy and they need to be on the road. Next month will be National Nursing Assistant Week from, I believe it's June 7th to the 14th, and we will have activities for them during that time as well.
Thank you, Julie. I'm real jealous of that Olive Garden. That sounds pretty tasty.
I know, it does, doesn't it?
All right, up next we have Mary from the Meadows. Mary, if you want to unmute yourself.
Hi. I still see on the screen the woman from the home health, from Cambridge Home Health.
On your screen, it's going to be a little delayed. If you look on our screen, it's showing the STNA because you're signed in also as an attendee. So you are actually good. Your Meadows is up.
Okay. Well, hi, everybody. My name is Mary Engelhardt. I'm the administrator at Meadows of Osborne Park. And we are a CMS 5-star rated facility, which is a direct reflection of the staff that are currently at Meadows at Osborne Park. We've got 5-star staff because you don't become a 5-star building without your staff. And so we're looking for additional 5-star staff. We are hiring for STNAs and nurses, primarily STNAs and LPNs. But if you are an RN and you're interested in working at the Meadows, please do turn in your application. We have fabulous government benefits. It's the Ohio OPERS, and it's similar to the 401k, but because we're a governmental entity, we have the OPERS, and we match at $1.40 on the dollar. So for every dollar that you put in to what is the same as a 401k, the Meadows will put in $1.40. So that is just really fabulous and unheard of. So if you are into saving for your future, that's a great benefit. Very low cost medical insurance and dental and vision, and it's just a $75,000 life insurance. It's a great governmental package. If you are not a licensed STNA, we have begun a STNA training program, so you can train, work, and get paid while you're training. Our rate of pay for a licensed STNA starts at $18.71 an hour. So you wouldn't be making that much as a trainee, but once you have completed your training, you would immediately go to $18.71 an hour. And as you can see up at the top, the LPNs start at $23.53 an hour. The way that you apply is either on Indeed, or you can apply at Ohio Means Jobs. You can also apply at the Erie-County website, or you can just call the facility at the number on your screen, 419-627-8733, and we can direct you through that process. This is a county job, and we have a lot of long-time employees. We have employees that have been there 30 years, many that have been there 15 and more. The facility has been newly renovated. It's just gorgeous. The rooms, if you are a current nurse or STNA, the rooms are just huge. I'm kind of new to the facility, and when I first toured it, I could not believe how big the rooms are. So there's plenty of space for the residents. We have lots of private rooms as well as semi-private, a great new therapy gym. It's just, if you have not seen it lately, it's just stunning. We have a, I'm not used to doing this sort of thing. So bottom line is, we are looking for the kind of person that we're looking for is, like many have said, it really takes a special kind of person to provide loving care. The expectation is that you would treat our residents with respect and dignity, and that you would treat them just exactly as you would have one of your parents or grandparents or a beloved aunt or uncle treated. And that's the kind of person we're looking for: reliable, dependable, and just to do this sort of work, you really have to love serving people and helping to take care of people. If you have questions, you can reach out to, you can call the facility, you can reach out to me directly. Our Director of Nursing, Donna Patrick, is extremely accessible. Pretty much anybody there can answer questions and guide and direct you toward your new future. I think that's pretty much all I have to say.
All right, thank you, Mary. So yeah, as Mary said, you can always reach out and ask questions. If you have a specific question now, again, you can go ahead and put it in the QA and we can get it over to her. Up next, we have Kayla from Admirals Point.
Hi, everyone. My name is Kayla. I am the HR director here at Admirals Point. We are a skilled nursing facility in Huron, Ohio. We are part of a larger corporation called Foundations Health. We own 57 facilities here in Ohio. We are also a 5-star rated facility by the CMS. We are currently remodeling our facility here, so there's lots of updates, lots of changes. Positions that we hire for, as many are, LPN, RN, STNA. You have to be licensed for all of those positions. We also hire for cook, activity aides, housekeeping, receptionist, and dietary. Employees here are the same as many others. We'd like them to be team players, committed to us here and the residents that they take care of. We offer benefits for our full-time employees. They include health insurance, 401k match. We do have tuition reimbursement that a lot of our employees take advantage of. We also offer assistance with STNA schooling, getting people licensed to become STNAs here with us. We also have PTO plans, so paid time off. You can apply through Indeed, through our website, and also walk in here at the facility.
Awesome. Thank you, Kayla. And last but not least, we have Laura Lee from Sandusky Career Center with us.
Hello, everybody. My name is Laura Lee Crable, and I am a registered nurse. And I am in a little different situation than the three ladies before me. I am the director of the educational program that could get you one of those jobs in those nursing homes or long-term care facilities. So I'm just going to talk about all the different types of healthcare positions, licenses that you can get so that you can be hired in any kind of healthcare facility. So the first slide that I have is the different types of positions that you can go to school for, and this is all over Erie-County and also beyond. Some of the other people mentioned STNA, state tested nursing assistants, licensed practical nurses. We do offer LPN certifications here, also registered nurses. And then the rest of these are not actually offered at a career center. They'd be more likely to be at a college level. Advanced practice nurses, physicians, physician assistants, respiratory therapy, radiology, physical therapy, and then physical therapy assistants. And we use all of these types of healthcare workers in this area. Occupational therapists and occupational therapy assistants. One thing that's not on this chart is medical assistants, and they work primarily in urgent cares and in physician offices. And that program is offered in a lot of the areas around here. If you would flip to the next slide, I think it's important to know how many hours it's going to take to become that person and what the salary is going to be, and also what the educational cost might be. So for STNAs, you can go to a variety of different locations to become an STNA, and the minimum number of hours in the classroom is around 30, and then you actually go do skills afterwards and actually take care of some of the patients and residents. And depending on where you look, the average salary for an STNA is about $14. Now it is more in some of the government agencies, and the career centers around here, or at least in the Sandusky area, are within the career centers. There's a couple in Sandusky and in Milan also at Ehovie. The medical assisting program for us is also tied into phlebotomy, because we found out that a lot of people that want to do medical assisting also like the phlebotomy, and they can switch in a doctor's office to doing both and being a little bit more employable because they have 2 skills and 2 certificates. Most of the MA and phlebotomy programs are about 900 hours. Average salary to start an MA or a phlebotomist is $15, and the cost of the program is around $13. LPNs are normally a program that's about a year. the requirement for the Ohio Board of Nursing is like 37 weeks. And LPN and LPN to RN and RN and also advanced practice nurses is also authorized by the Ohio Board of Nursing. So 1 year program, they can average about $18.71 an hour. And depending on which program you go to, it might cost you about $16,000. So there's also an LPN to an RN. You have to start this program with an LPN license. And the Board of Nursing says it has to be a minimum of 45 weeks. And $23.51 is an average salary per hour. And the cost of an LPN to RN program can be about $18,000. You can also go to a college. I have a daughter that went to Capital University before all these programs were up and running in this area. So you can go to a 2-year, 3-year, 4-year, or 5-year program. An average salary would be $34 an hour. Probably a lot more in the big cities, and also there would be shift differential. If you work a 12-hour and work 7P to 7A, there probably is a little bit of shift differential, with an average salary of $80,000 a year. And some people choose to go to school for 6 years, and their average salary is $51 an hour. And the school can be, depending on where you go, $150,000. So you've got a huge range. One nice thing about healthcare also is that as you start with your MA, there might be classes that transfer to your LPN, and then some classes transfer from your LPN to RN. So a lot of different in terms of salaries, and also a lot of difference in terms of years in school and cost for that program. So to get into many or all different types of healthcare facilities, there's an entrance exam. At career centers, we normally give work keys, and there's certain standards that you need to meet. Or if you go to something beyond a career center, you might have to take the SAT or the ACT or different tests for that college. To be in healthcare, BCI and FBIs are normally required. One person said they wanted an unencumbered license, and a BCI could encumber that license and prevent you from getting into healthcare or even getting into a position. Drug screens are required, high school transcripts or any type of high school equivalent. And if you have previous college transcripts, they're probably going to look at that and maybe look at it and say, okay, you took medical terminology at college XYZ. If you come to a career center, we won't require you to take it because you've already had it. And then just kind of wrapping up and explaining a little bit more. To be a nurse practitioner or an educator, and we hear this a lot, and if you go to an urgent care, you might see a nurse practitioner. That's the person that's probably been to school for 6 years. She's making the most of anybody on that list, but they can work as a nurse practitioner, an educator, seeing patients in a hospital, seeing patients in an emergency room. They're the highest educated nurse that we have. They can add on to this a doctorate degree, but these are all types of nurses that can care for patients. And then what I love about being in healthcare, every day is a different day. I've been a nurse for a little over 40 years. I lived in Columbus, so I worked at a hospital there. My husband transferred to a job in Huron, and so I was easily able to get a job in Sandusky. I worked at the time for Providence Hospital. You can do research. There's nurses and doctors' offices that do research on what drug works best. You can be in a doctor's office. You can also do pharmaceutical or be a sales representative. I love orthopedic nursing, bones and muscles and joints, and sometimes those sales reps actually come into the operating room and bring the type of equipment that might be needed to put in a total hip or a total knee. You can teach, you can work for veteran services, you can work in the military, and one nice thing about healthcare that you can move any place in the United States and Canada. Your license works in all states and also in Canada. So if I wanted to move to Florida, or I wanted to move to California or Maine, I would contact that board of nursing and not transfer, but get my license in any state. And I can do that with just, actually, all you do is give them some money and they look at your Ohio license and say, yes, you can have a license wherever. Just send us $65 and we'll print you off a license. So if you have any questions, I put the email addresses of the two people that are in charge of the programs. Laura Lee is me, and I'm in charge of the medical assisting and the LPN. And Elizabeth, if your ultimate goal is to be an RN, at some point in time, you're going to want to talk to Elizabeth, because you'll be an LPN first, and then you'll go on and be able to sign up for an LPN to RN program. And that YouTube that I included is one that is printed and put out by the Cleveland Clinic. It kind of pulls at your heartstrings. You see people coming into the hospital and leaving the hospital and what they're imagining as they are in the hospital. Again, it pulls on your heartstrings, but that's kind of what nurses are and do. They have to look at people in the hallway and think, oh, you're going to go get good news, or you're going to go watch your baby being born. And sometimes you actually see a dog in the hallway as dog therapy. So nursing and healthcare has lots of variety. You can move up as you want to. You can stay in a program that just is a few hours, or come to a program that's a lot, and enjoy taking care of patients, family members, and also the community to make sure everybody's getting their COVID vaccine, signing up to take care of people, and just sit in a gym and educate people and give that vaccine to them.
Awesome. Thank you, Laura Lee. That was a lot of great information. And I will make sure to get that PowerPoint and all the flyers that you guys seen today out to everybody who is participating. And also that way you can watch the YouTube that she put in there. There is a lot of opportunity in this field. And if you don't have your license yet, please make sure to check out the local schools. And then we also always offer the WIOA funding here. So if you just don't have the needs to pay to go back to school, please give us a call and we will go over our WIOA program with you and see if we can help pay for some of that or all of it for you. So you can reach us at any time to discuss that. Also, we do have our youth program kicking off this week. It is a summer youth employment program. So if you know anyone between the ages of 14 and 18 who is looking for employment for the summer, who doesn't want to be tied down to permanent employment and have to quit when school starts, they can contact us and we can get them set up. Basically, we have a lot of employers lined up to take on these kids. And so I'll send out some flyers on that as well. I will put that out in the attendee link with all the rest of the flyers. A big thank you to everybody who presented today. You guys gave a lot of wonderful information, and any questions that come in, we will get sent over to you. Thank you everyone for joining us, and I hope everyone has a wonderful day.